I feel great for the people who talk to me every day in the grocery store and on airplanes and stop me on sidewalks and tell me that this has changed their life forever. They no longer have to worry about affording health care if they get sick, taking care of their kids, and this is a very good day for those Americans.
Well, like the Sally Ride of healthcare. Well, welcome back to the Daily Wrap. I'm Joe Concha, joined by my co-host Rick Unger, and filling out the panel, Hanson and Tucker. All right. That was former Health and Human Services Secretary Kathleen Sebelius, and she was on talking about, of course, the Supreme Court ruling upholding Obamacare subsidies for more than 6 million Americans. We are now joined by Dr. Richard Amerling. He is the Associate Professor of Clinical Medicine at Mount Sinai Beth Israel Hospital in New York City. Dr. Amerling is also the President of the Association of American Physicians and Surgeons. Dr. Amerling, thank you for joining us. We appreciate it.
My pleasure. How are you guys?
I'm doing well, thank you. So what does the High Court's ruling mean for our health care?
Well, it solidifies Obamacare, at least for the next 15, 16 months. I don't see it going anywhere. Of course, the big battle, as far as I'm concerned now, is Medicare. And Medicare has always been a huge problem, but it's gotten a lot worse. And there are going to be a lot more seniors going on to Medicare over the next 10 years. So that is technically a bigger problem than Obamacare right now. But look, Obamacare perpetuates this incredible bureaucratization of medicine, where it's getting harder and harder for doctors to actually provide care. And we get back to this whole idea about coverage versus care. Coverage is not care. Coverage is some sort of a card that says that you may be able to get care if you could find a willing provider. But that's going to become harder and harder. I mean, Obamacare has not created new doctors. In fact, doctors are leaving the profession at a higher rate than ever before.
Doctor, it's Rick Unger. You know, it was interesting that you brought up Medicare, because I know that your organization that you lead was against Medicare going all the way back to the beginning. I know you guys have been around since the 40s. When you add to that your organization also doesn't believe that HIV causes AIDS, you think there is a link between autism and vaccinations, I got to ask, why would we expect Americans to take seriously the your academy, your group?
Well, Rick, you're using the typical liberal trick of character assassination. First of all,
was anything I said untrue?
The AAPS does not have any problem with the HIV hypothesis for AIDS. And you are mistaking what may appear in a journal article.
Your journal.
An opinion of the journal, of the organization. It is not. The articles that appear in the journal, which is peer reviewed, by the way, are simply articles. They don't reflect our point of view.
So that's not, just so we're clear and so the audience is clear, it's not your point of view then. You're saying that you don't think there's a leak.
No, we're scientific physicians.
Okay, because I did read an article, not just by the journal, but the opinion of your organization on that. But let me ask you this. The AMA supports Obamacare. The National Physician Alliance supports it. American Academy of Family Physicians supports it. Where do you think they're missing this? Why are they supporting it and you guys don't?
A lot of so-called official medicine supports Obamacare. The official medicine does not necessarily represent the rank-and-file physicians working in the trenches out there in practice.
So your organization does.
Nor does the AMA. The AMA, by the way, also opposed Medicare. And that was probably the last time they were on the right side of an issue. Medicare was, in fact, the foot in the door for socialized health care. And we're seeing the fruition now with not just Obamacare, but CHIP.
And yet Medicare is very popular.
Most entitlements become popular. Is that not true? People
yeah.
Okay.
I know an awful lot of conservatives who sure like their Medicare.
It's a bureaucratic, difficult program. It's going to be bankrupt within our lifetime unless things change radically. It pays doctors very poorly. Doctors are opting out of Medicare increasingly. And you're not going to be able to find doctors to take care of you under Medicare, which is of some concern to me because I'm rapidly approaching Medicare age.
Doctor, let me get your reaction to what 2016 Democratic hopeful Bernie Sanders said over the weekend. He says Obamacare doesn't go far enough. Take a listen.
We need to join the rest of the industrialized world. We are the only major country on Earth that doesn't guarantee health care to all people as a right. and yet we end up spending much more than they do. So I do believe that we have to move toward a Medicare for all, single-payer system.
So, doctor, do we want socialized medicine like they have in Europe?
Or like they tried to get in Vermont, Bernie Sanders' home state, but couldn't do it because it was too expensive? No, we don't. Socialized health care, again, you cannot guarantee health care for all. That is an impossibility. All you can do is say you're going to pay a certain amount of money. And then it's up to the physicians and the nurses to actually provide the care. So this whole idea of a guaranteed to health care is absolutely absurd. This whole idea to a right to health care is absurd. You have a right to pay for your money and buy health care. You do not have a right for someone else to give you health care.
Dr. Richard Amerling, Associate Professor of Clinical Medicine at Mount Sinai Beth Israel Hospital in New York City. Thanks so much for joining us. We appreciate it.
Great, my pleasure.
All right. So let's go around the table. Bill, I want to get you in.
Well, I didn't have a chance to ask this, but I don't understand why he calls it a post-constitutional crisis. Yeah. This was a law passed by Congress. It's not a law I support. I don't think it's a good idea. I don't like it, but I don't understand the post-constitutional crisis part.
I think he has a very good point. It's the same point in a Wall Street Journal op-ed today about the difference between insurance and care. A lot of people have insurance, and I think that that's fabulous. But with more and more patients enrolling, fewer and fewer doctors participating, we are going to have a crisis in care. And I think that that's something that hasn't been yet discussed and it hasn't been anticipated, and I don't know what we're going to do.
He also wasn't being completely forthright in some of his answers to my questions, and his last point was odd. Nobody says there's a right to health care in the United States. There is no right. That doesn't mean that a socialized system couldn't work. We can argue that.
On the crisis point, you're exactly right in terms of doctors not being incentivized or young people to go in because it's 10 years out of your life and it's really expensive. Anyway, back with more in a moment.